Hi class, my name is Amy Clapsey, and today I'll be discussing cultural competence and diversity in the healthcare environment. This section is dedicated to cultural competency and diversity in the healthcare environment, training information for treating and managing cultural and diverse populations for physicians, nurses, and leadership staff at the Methodist Hospital in Houston, Texas. The staff at Methodist Hospital primarily treats a traditionally underserved population with a diversity profile of approximately 37% Hispanic patients, 25% Black patients, 5% Asian patients, 30% white patients, and roughly 3% of other undefined races. The purpose of training is to provide recommendations for training staff in treating and managing culturally diverse populations in the healthcare environment. Because all people are influenced by cultural programming such as values, beliefs, morals, and customs, most have likely acquired patterns of ideas and behaviors that could potentially harbor attitudes or beliefs about groups under their care. For example, stereotypic views such as Asians are stoic or Latinos are emotional can harm our patient-provider relationships by blocking communication. Another example of destructive cultural incompetence is cultural incapacity. This is a belief of supremacy of one group, which can lead to ineffective medical practice due to a paternal or maternal posture towards minorities. However, the goal for all providers is to become culturally proficient in a multicultural society, such as the patient demographic of Methodist Hospital in Houston, Texas. A truly culturally competent individual has a heightened awareness and appreciation for patients' differences in self-disclosing, in interacting in the provider-patient relationship, and in perceptions of illness and risks of disease. Training strategies are often underutilized even though they are fairly simple and straightforward. Training strategies include teaching to understand cultural programming, teaching to acknowledge differences, teaching to institutionalize cultural knowledge, as well as teaching to value diversity. Providing culturally appropriate education and self-awareness training to the physicians, nurses, and leadership staff will aid in improving care and eliminating health disparities while providing high-quality patient care. Training activities such as cultural competence self-assessments are wonderful tools to help individuals explore the communication boundaries and barriers of others while opening the door to cultural uniqueness. Cultural competence self-assessments include questions such as, do I ensure that printed information is disseminated to take into account the average literacy levels of individuals and families receiving services by my healthcare organization? Do I display pictures, posters, artwork, and other decor that reflect the cultures and ethnic backgrounds of my clients and patients? Do I understand that it may be necessary to use alternatives to written communications for some individuals and families? And do I avoid imposing values that may conflict or be inconsistent with those of cultures or ethnic groups other than my own? Other resources include self-test videos, and the University of Georgetown offers a myriad of resources for the working individual as well as patients and general allied health staff.